So South African doctors, like their colleagues across the world, have been right at the forefront of the battle and tragic consequences of the coronavirus pandemic. With the third wave of the pandemic now seemingly loosening its grip on Gauteng, how are doctors in the province doing? We're joined now by Dr. Mpilo Sithole, who works at a public hospital in the province. Doctor, grateful for your time. Thank you so much for being with us. Everyone has been speaking about this apparent drop in the official recordings of COVID-19 infections. Is that drop reflected in the wards where you work?
Good afternoon, Simbekile. Good afternoon to your viewers. So it certainly is. I think towards the middle of last week, going into the weekend, we are starting to see a decline in the number of admissions.
And does it all, Doctor, without involving you too much in the politics of it all, is it all down to the lockdown restrictions themselves?
Definitely. Well, not all down to the lockdown restrictions, but they definitely do play a part in easing the spread of the virus within the province. Sorry, it does help with decreasing the spread in the province. However, I don't think the significant drop is largely attributed to the restrictions.
Give us an idea, Dr. Sithole, at the peak of the third wave in Gauteng, what was the scene where you work? What sort of cases were you seeing and dealing with, and capacity, for example?
All right, so I'm based in the COVID ward, and Simbekile, it was incredibly challenging. It was demanding. I think it physically required more from us, this wave, actually more than the other two waves. We spent longer hours on our feet. We were admitting much more patients than we have admitted ever, I guess, since the pandemic started. And I'd say around the week of the 21st of June, it's when it began to be really overwhelming. Basically, from shift handover to handover, we had pending admissions, a continuous influx of patients.
And where did you all find the strength to deal with it all?
Sure. Simbekile, I guess it's just, we've just all soldiered up, employed a day-by-day approach to the pandemic. We are fortunate to have quite good leadership. In my departments, we are led by quite present leadership. So we just take, I guess, guides and guide from our leaders. And protocols that have been generated from all over the world have helped us in feeling confident in treating our patients.
And now
support structure. Yeah, I can't speak for my colleagues, but I'm blessed to have a supportive structure. I can go home at the end of the day and just debrief with my family.
And I'm not sure how long you've been a doctor, but I don't imagine that you've ever seen anything on this scale as a healthcare professional.
Definitely not. I just remember one night being on call during that week that I was referring to, the 21st of June, and I was just in so much disbelief at the number of patients we were actually admitting. I just was in so much disbelief, and I don't know, I just had a chilling moment of what India might have been going through, because we saw the numbers that were reported, and obviously we got nowhere near to where India was. But definitely nothing I've ever seen in my lifetime, and nothing I saw in the previous two waves. This wave was quite crazy.
We're often told when we listen to the presentations and there's an announcement of restrictions on the sale of alcohol, for example, that at the core is an attempt to ease pressure, the burden from trauma cases that may be due to accidents, for example, that result from people drinking and driving, or the violence that sadly in South Africa follows drinking in some communities. Was it particularly helpful at your hospital?
Yes, it definitely was. I think a lot of trauma that we see in our country is associated with alcohol use. So, I think not just my hospital colleagues that I've spoken to can attest that when we are in the periods of complete alcohol lockdown, it does sort of damper the strain in terms of trauma cases. And I must say also, just in light of the protests that we had in the last 2 weeks, we obviously then saw an uptake of trauma, and we don't know whether there was alcohol involved or not alcohol involved, but certainly we were seeing more trauma cases, and that definitely stresses the hospital, stresses casualty. Last week also was quite a jarring sight, just having to deal with the patients who cannot breathe, patients who are just gasping for air, and then the sights of blood, gunshots and stuff. So definitely the absence of alcohol decreases the amount of trauma that is seen.
And at the beginning of the pandemic, healthcare workers were calling for adequate amounts of personal protective equipment. Vaccinations hadn't started this time last year. Now, majority of you have been vaccinated. Has that had a difference, a major benefit as far as your ability to staff wards and hopefully, mostly, the loss of life among healthcare workers?
I think the latter. The vaccination has definitely helped in terms of preserving the life of our colleagues. A couple of our colleagues have contracted the virus post-vaccination, but they've fared pretty okay. Even those who meet the profile of increased BMI, comorbidities, actually didn't even require hospital admission. So there's definitely benefits in vaccinating and having had our colleagues vaccinate. I do, however, I think vaccination hasn't really helped the strain and the workload we face, because whether or not you don't require hospitalization, you do need to take the 10 days isolation. So whenever any one of us gets ill, it's one man down. And so, I guess the vaccination hasn't really relieved the strain or the amount of the work, like the capacity of the workforce. It just has helped our colleagues not to find themselves being admitted into hospitals or us having to gather and say bye to one of our colleagues. Yeah.
And if you had President Cyril Ramaphosa's ear tonight as we wait for him to speak sometime today, we're hoping he's watching Newzroom Afrika today as he prepares, what would you, as someone who works in a COVID-19 ward, say to the President?
I'd ask him to please see through with some of the promises that have been made to the healthcare workers in terms of increased human resource, increased capacity, hiring more doctors. I can't vouch for other hospitals, but certainly where I work, we haven't really received any more doctors. I haven't really seen an uptake of the allied healthcare professionals. So I'd ask him certainly to please see that whoever he's working with, the relevant persons do come through with what's been promised. Basic PPE. If anything, providing your healthcare workers with PPE is respectful. So I would definitely, it's just basic, it's mundane. So we're not asking for a lot, but we're just asking that the mundane promises be seen to.
So a request from government, for government to keep its word from healthcare workers. Dr. Mpilo Sithole, thank you so much for all that you've done through the past year and a half, saving lives in South Africa as many of us continue to battle COVID-19. We're seeing a drop in infections in the province, and we hope it stays that way. Thank you.
All right. Thanks, Tembegile.